The next paper by Dr. Abualzayem from Saudi Arabia about the advantage of Transobturator Tape Procedure for surgical treatment of female stress urinary incontinence.
Mr. Chairman, dear colleagues, I'm Dr. Khaled Abualzayem, an Egyptian doctor working in the Saudi German hospital in Jeddah. Our issue today is the advantage of transobturator tape for surgical treatment of female stress urinary incontinence. Assessment of the new our objective is assessment of the new technique for transobturator suburethral tape in the treatment of female stress urinary incontinence. A total of 34 patients with stress urinary incontinence were enrolled in this study, and a minimum of 1 year follow-up was available for 18 patients. Our results showed that 31 patients were cured and 3 patients were improved. Mean operative time was 15 minutes. No intraoperative complications were recorded, and there were no problems with urethral erosion or functional impairment related to the tape. Our conclusion is that evaluation of the results after a longer follow-up period is needed, and transobturator tape is a simple and effective procedure for the treatment of female stress urinary incontinence, confirmed after 1 year of follow-up. The transobturator approach avoids the risk of bladder, bowel, and vascular injuries. Thank you.
Any questions from the floor?
Dr. Hassan.
For next work, I just want to ask, did you have any patients that went into retention after the surgery?
No, we don't have retention for these patients. But there is some other complications. It's already illustrated in the poster. I cannot illustrate all of this here. There is some erosion, there is some infection, there is some post-operative pain, but no retention.
One more question. Have you used the new tape from the one from Mentor, the Iris? It's the same company, like all tape, but they have changed to a newer tape called Iris. They are saying that it has less implantation material. Have you used that or compared this?
No, we are using the tape only.
Thank you.
Welcome.
Your technique from inside out or from outside in?
From outside in.
Outside in.
Yes.
Do you need cystoscopy?
No.
Post-tape?
No.
For me, I just want to, if it's cure and improvement, you should have criteria for improvement.
Of course.
The patient is still leaking, so...
No, patient is not leaking. Most of our patients, the cured patients are not leaking. The improved patients, the leaking is less than before. You mean that you should have subjective factor or subjective to evaluate your improvement. But no, this is just by the history of the patients.
And are you sure that this partly improvement is not due to other combination factors like urgent incontinence, etc.?
Of course, but okay. This is also, all this are illustrated in the poster because we have the exclusion criteria and the inclusion criteria and all these things.
Thank you very much, Dr.
Welcome.